not that top this time. Okay, hi, Assalamualaikum. I hope you can hear me. Alright, so how is everybody doing? Good? So I think it's probably be about, I don't know, 3 weeks post MCO. I hope everybody is doing well, healthy, safe at home, happy with your loved ones, yeah? So thank you so much for spending your Friday afternoon with me today. And today I'm going to share on childhood vaccinations, and feel free to post any comments, or if you have any experience that you want to share, any concerns, please place them under the comment section below, and I will try and move on from there. Okay, so okay. Yeah, okay, so I'm Dr. Tengku Putri Zainab. I'm the resident consultant pediatrician at Sunway Specialist Center, Damansara. Yeah. Okay, thank you for being online. Okay, so regarding childhood vaccinations, I have actually selected this topic because, as you know now, the COVID-19 pandemic, and everybody is worried about the COVID-19 vaccine. So we know that the vaccine will not be available anytime soon. So that will be only available maybe around 18 months, as what WHO said at least, or in fact maybe years to come. So instead of just worrying about something which is not available yet, why don't we focus something that is preventable, which is vaccine? Yeah? As you know, vaccine is something, is a very good preventive mode against serious illnesses. Yeah. So okay, so again, let me remind you again, if you, let's say you have any questions, please post them down below. And I also have a few questions that we have compiled beforehand from those who have informed us through our FB page, and also PM us through our mobile number. Yeah. Okay, so I'll just give a brief overview on childhood vaccinations. So childhood vaccinations can be broadly categorized into compulsory and also optional vaccinations. When we talk about compulsory vaccinations, that will actually cover 12 different diseases. Yeah. So for example, the vaccines for compulsory vaccines would be like BCG vaccine, hepatitis B vaccines, these two vaccines which are given from birth itself, and then subsequently at 2 months, 3 months, 5 months, that would be the 5-in-1 vaccine, which is the diphtheria, pertussis and tetanus, and also the polio and the Haemophilus influenza vaccine. Then after that, 9 months and 12 months, that would be the MMR vaccine, so that covers against measles, mumps and rubella. There's also the JE vaccine, or the Japanese encephalitis vaccine, so that's given for those living in Sabah where JE is more prevalent. And subsequently the HPV vaccine, or the human papilloma virus vaccine, so that's given for the ones aged 13 and only for girls so far, right? So these vaccines are inside the national immunization program. So the compulsory vaccines are actually offered for free by the government, regardless if the baby was born at a private hospital or a government hospital. If let's say you bring your child to a clinic kesihatan or a health clinic, that's provided for free. But of course, these vaccines are also available at any private centers. All right. So again, if you have any questions, please post down below. Yeah. So I will just go through one of the questions that has been given to us prior. Yeah. So the first question is, how do I make immunization easier for my child, as he's always crying before even going to the appointment? Okay. So I think most doctors will agree that giving vaccines for infants is actually easier compared to giving to older child. Because given to an older child, because they are bigger, they are stronger, they tend to fight, yeah. So it can be very challenging. So when it comes to vaccinating an older child, actually we do need the parents' cooperation, yeah. Prior to that, actually it involves a lot of psychological or more like education to your child. Because I do notice parents, they use doctors to scare their child whenever their child misbehave or being naughty. For example, let's say your child is naughty, not behaving, and then you say, oh, I'm going to bring to the doctor and you will get a vaccine from your doctor, kena cucuk. So if you say these kind of things, you are actually making your child scared to see a doctor. So that will make things very difficult for us, because here we are trying to be very gentle and friendly to your child, but if they already have this preoccupied vision that the doctor is very mean and going to jab me, it's going to be very difficult. Okay, so another thing is that you could actually educate your child, yeah, prior to that. Tell them what is this vaccine about. For example, if let's say you want to bring your child for influenza vaccine, so you tell them, okay, this is a flu shot, and this flu shot is for fever, cough, and make you very ill, and even make you can cause you to be hospitalized. So that's why this vaccine is important. So if you do explain this to your child, so it will lessen their fear. They will still be very scared, but at least they understand what is this vaccine for. Okay, so for older children, you can tell them these things, right? And also reassure them and tell them what's going to happen. Okay, doctor is going to jab, but after that it's going to be a bit painful, but you can have fever, but if you feel painful, then we can give some medicine to reduce the pain. Okay, so give some reassurance. And then before that, you can actually bring things to distract your child. For example, if let's say they have their own security blanket or their favorite toy, or you can even like prepare their video that they like, okay? And then during the vaccination itself, you can actually distract them with the toy or the toys that whatever songs that you have prepared, or you can even sing a song with them, yeah, just to distract them. And older children also, you can actually practice with them deep breaths, like some form of like a relaxation technique, like breathe in, breathe out, breathe in, breathe out, okay, just to relax them. Okay, so these are some of the tips that you can practice. All right. Okay, so moving on, I've discussed about the compulsory vaccination. So let me just tell you what are the available optional vaccines available. Okay, so there are a couple of optional vaccines available, but when we say they are optional, it doesn't mean that they are not important. Okay, because some people, they have the perception that, well, it's optional, so it's okay if I don't take them, but it's still important because it can prevent against serious diseases. Yeah. And these optional vaccinations, perhaps with time, the government will actually put put these optional vaccines inside their national immunization program. It depends on their budget. Because as you know, one of the optional vaccines would be like the pneumococcal vaccine. So the pneumococcal vaccine that has been announced in the budget 2020 that they've allocated 60 million ringgit for the pneumococcal vaccine. So that is supposed to be available this year by June. But with this COVID pandemic and the recent change in government, we are not sure whether that will be so, right? And even if the vaccine is available in the government, they will also impose certain inclusion criteria, meaning it's only for kids who are born in the year 2020, or maybe they will say only kids with an underlying medical condition, then only they will be eligible to take the pneumococcal vaccine. Okay, so at the moment we still advocate people to still continue to bring their kids over to the clinic to get the pneumococcal vaccine. Okay, so what is pneumococcal vaccine? Okay, pneumococcal vaccine will actually prevent from getting streptococcus pneumonia infection. So this strep pneumonia infection is one of the most common causes of severe pneumonia in children. Okay, so who should get these vaccines? CDC actually advocates for children less than 2 years old to get the pneumococcal vaccine. Okay, and those kids above 2 years old, especially if they have any medical problems like asthma, or they have heart disease, kidney disease, and they are more likely to be needed the pneumococcal vaccine. Okay, so especially the high risk individuals. Yeah. So so how many doses is needed? Well, it depends when is the first dose given. So the first dose that can, the youngest child that can take a pneumococcal vaccine, that will be 2 months old baby. Okay, so if let's say the first dose is given at 2 months old, then you will between 2 months to 6 months old, then the child will need 4 doses. So let's say in between 6 months to 1 year, then the child will need 3 doses. 1 year to 2 years, then the child will need 2 doses, and after 2 years old, then the child will only need 1 dose. But when we talk about that, some will argue and say, why don't I just wait until 2 years old? So at least I can save money. I don't need to give too many vaccines to my child, right? But the thing is, as you know, when a young child, infants especially, they are more prone to get serious illnesses. Okay, and this pneumococcal vaccine will actually prevent from getting invasive and also non-invasive pneumococcal disease. When we talk about invasive disease, so that includes brain infection, or it's called meningitis, particularly infection over the lining of the brain and also the spinal cord, and also the infection over the blood. So these are bloodstream infections. So these infections are very dangerous. Why is called invasive? Because in that particular organ, by right, there shouldn't be any germs, but there's germs there. So that's why it's very serious and severe. So particularly in young children like infants, if they do get this invasive pneumococcal disease, it is very dangerous because number one, it can cause the child to be hospitalized, needing long-term antibiotics, and things like meningitis and bloodstream infection. A person can even die from the infection. Okay, so let's say if a person has got the bloodstream infection, the risk of death is actually 1 in 100. Yeah, and if let's say there is already like a brain infection, the risk of death is actually 1 in 15. Okay, so in fact, if a child do survive from the infection, there is also a risk of getting developmental delay or even hearing loss from the infection itself. Okay, so there's a question from Is Nabila. She asks, why do we need to get some vaccines each year, but others only once, like flu vaccine? Okay, so it depends on the vaccine. Okay, each vaccine is different. And also it depends when the child gets the first vaccine. For example, like I mentioned earlier, the pneumococcal vaccine, if it's taken earlier, less than 6 months old, then we'll need 4 doses. 3, 2, 1, as what I've mentioned earlier. Some will need 2 doses, like chickenpox. Like the 5-in-1 that I mentioned, will need 4 doses, including the booster. Okay, but the thing is something like if you talk about influenza vaccine, well, that depends again on the age of the child. Yeah, if let's say the child is less than 9 years old, then the child, if never, let's say, never taken the influenza vaccine before, then the child will need 2 doses of the influenza vaccine. So that's supposed to be 1 month apart. And then after the age of 9 years old, then the child will only need 1 dose of influenza vaccine. And then subsequently, the child will only need a single dose of the influenza vaccine each time. But the question is here, why must it be taken every year? Okay, for influenza vaccine, the thing is it's because of two reasons. Number one, if let's say after taking the influenza vaccine, it will boost up the immunity, and then after that the immunity will actually be reduced and will be weaned off towards the end of 1 year, and after that we'll need to retake the vaccine again. Okay, so because immunity will not last longer than 1 year, that's one. Number two, you know that the strains in the influenza vaccine will change with each season. Okay, so the influenza vaccine actually includes 4 different vaccines. It's called a quadrivalent vaccine, so it's 4 different viruses in the vaccines. Influenza A, 2 types of viruses, and influenza B, 2 types of viruses. Okay, so these viruses or the strains in the vaccines, they get renewed every year depending on the prevalence and what subtype of the virus that's prevalent during that particular time. Okay, during that winter season. For example, if we're talking about northern and southern strain, so if let's say during the winter time, they will see what is the common virus during that time, and then 6 months after that, then they will develop the new vaccines using what the strains that is common during that winter time. Like macam let's say it's northern, then that will be towards the end of the year, yeah. And then if let's say it's southern, then that's the beginning of the year. So that's how it works. So that's the reason why you need to take the influenza vaccine every year. Okay, so what is this? There's another question from Hazira. Question is, I'm afraid of taking my child to the clinic. As I was browsing through Google, it mentioned aloe vera gel can bring down temperature if it's applied on folded areas such as armpit. So I have purchased aloe vera gel and stored it in the fridge. Is it advisable to use it? Please advise. Thank you. Okay. During the MCO, now we are MCO period. Everybody is very scared to go out. Okay, I understand why. It is, you can only go out for essential services, and we try to avoid the healthcare system as if possible. Okay, especially for those with children, you feel very scared to bring your child out. Okay, but the thing is, bear in mind that there are certain things that you will need to bring your child out. Okay, for example, if your child has got high-grade fever for 3 days or more, having vomiting or diarrhea, having difficulty to breathe, dehydrated, like not passing urine at all, crying without any tears, and appears unwell. So these are the conditions that you will need to bring your child to see a doctor. So if let's say your child do have mild symptoms and no known contact with any COVID-19 patients, okay, so you just want to self-treat at home, okay, you can, let's say a mild fever, a bit of cough, cold, yeah, you can treat your child with that. But the thing is, as a doctor, I will still advocate to take the medications that are recommended and approved by LKKM. If you are worried to bring your child to clinic, I'm sure if you have a person who is in charge in the house, maybe your partner or your husband, to actually go out safely, wear a mask, and go to the pharmacy and get the necessary medicine for your child. Okay, so you can buy paracetamol, okay, or even ibuprofen, but ibuprofen is stronger. Just stick to paracetamol and give to your child according to the recommended dose. Okay, so the dose itself, the pharmacy will actually advise you accordingly. Yeah, but if let's say you are self-treating your child at home, I still advise you to actually call your clinic, your pediatrician or your family doctor, to just ask your opinion over the phone, and just to check whether it's okay to give your child this so and so medicine. And you can also the doctor can also counter check with you the dose that you're giving to your child, yeah, the fever medicine, cough and cold medicine. But if let's say that worsens, please bring your child to the clinic, or please call your doctor to discuss about that. And don't keep your child like, for example, having fever for 1 week, you keep at home. Please don't do things like that. Okay, because things like aloe vera gel, and maybe you are trying all sorts of natural things at home, please please be careful. Yeah, please just stick to the medications that is advised by the doctor. Yeah, all right. So moving on, why don't I just go through some of the questions that being prepared pre-hand. Yeah? Okay, next question is, babies have natural immunity. Isn't that immunity better than immunity from vaccines? Okay, yeah, some people, they are actually worried or scared to give their babies vaccine. Okay, they feel like, yeah, baby already have immunity. That's true, because after delivery, babies will do get antibodies that's already been passed on from their mother through the placenta. So they do have some antibodies or immunoglobulins from there. And after the baby is born, if let's say the baby is straight away breastfeeding, then the first day the baby will receive colostrum, right? So that's like the liquid gold. So the colostrum will also have a lot of IgA, immunoglobulins there. And especially if let's say you continue breastfeeding will also have a lot of immune factors, so that will help with your child's immunity as well. Yeah, that's all true. But the thing is, for babies, especially infants, their immune system is there, but it's not strong enough to fight against severe infections. When we talk about severe infections, it means things like I've mentioned earlier, like those meningitis, yeah, like infection of the lining of the brain and the spinal cord, or very bad pneumonia. Okay, those diseases which are vaccine preventable. So with a normal immune system, even more for baby, definitely they cannot fight this kind of infection. So they will need vaccines to help to prevent, to get from this kind of vaccine preventable diseases. Yeah. So yes, please stick to vaccinations even though you think your child has got natural immunity. Okay, so next question is by, yes, Dr. Melissa. She's asking, if my 3-year-old son have high-grade fever that doesn't settle with paracetamol, can I give him Nurofen? I heard that there are some concerns. Okay, so when we talk about fever, yes, paracetamol will be the gold standard that we give. But I do know overseas, like maybe in the UK, they are used to giving NSAIDs or things like Nurofen, or another name is ibuprofen. Yeah, that is a type of an NSAID, and it is said that NSAID group on Nurofen is very stronger compared to paracetamol. Okay, what I would advise is that if let's say your child do have high-grade fever that doesn't settle with paracetamol, I would say that you should just stick with paracetamol, because there are some concerns. When you talk about concerns, I think I know what you're talking about. You're probably thinking about influenza infection, okay? Because for influenza infection, actually we do not recommend to give any form of NSAIDs, including Nurofen or ibuprofen, okay? Because that can result in a problem with the neurological system. Yeah, can cause your kid to be admitted to ICU. All right. So yeah, I wouldn't recommend to take Nurofen. In fact, even in COVID-19, there are some people, some postulations also said that maybe the NSAIDs can also make it worse. Okay, can provoke some immune reaction to that. So that's why at the moment I would say please don't start on Nurofen. If the temperature does not settle paracetamol, again, bring your child to see a doctor, or if you worry, at least give your doctor a call and ask from your doctor, and trying to discuss from there. Okay, because if it's high-grade fever not resolving, again, see whether it's a non-close contact or not to COVID-19, or maybe it can be due to any other viruses. Yeah, and we have to explore from there whether your child has got any other associated symptoms or not. Yeah. Okay, so next question is by Cheryl. Cheryl asks, can scheduled vaccines be postponed or delayed during the MCO? Okay, this is a very common question. Okay, people are very, very concerned, again, to bring their child out during the MCO, even for vaccines. Okay, but the thing is, as you know, 2 weeks back, our Prime Minister has come up with a press statement saying that you should not delay your child's compulsory vaccines, and also the antenatal checkups, okay, because you don't want the child to get any vaccine preventable diseases. Yeah, so if you ask me, yeah, when we talk about scheduled vaccines, I would prioritize the compulsory vaccines. Okay, if you're talking about the compulsory vaccines, I would advise to still stick to the schedule. Okay, and also if it's if your child is an infant, which means that if your child is less than 1 year old, then it's also better to just stick to the vaccination schedule at the moment, right? Because for an infant, that's the time when they get their first few vaccines. If let's say they don't get the vaccine, I don't know, maybe it could be the first vaccine. Okay, if there is the first vaccine is not given at all, it means that there will not be any immunity towards that disease, right? So that's why for infants to at least get the first few shots in first. If let's say we're talking about the booster shots that's given after 1 year, perhaps you want to delay that a bit, that's still okay. But the first few vaccines, that's important to build up the immune system towards that disease, all right? And another thing is that we don't know how long this MCO will last. Okay, we know that it's probably supposed to end by 14, but I don't know, in an hour's time we will know the announcement from our Prime Minister. He's I don't know, probably he's going to say whether it's going to be continued or stopped. We're not sure, okay? So if let's say you want to postpone, how long you want to postpone it? Let's say if the MCO gets extended, you still want to postpone or you want to come to the clinic, right? So if let's say you want to postpone to a week or two, I think that's still okay, but not longer than that, okay? So it's there's no really like hard and fast rule, but again, I would like to advise you to at least call the clinic. Let's say if your child is being followed up to a certain clinic, please speak to the doctor and discuss whether can postpone, or if can postpone, over how long, because sometimes it also depends on the age of your child, what vaccine is it, and which dose is it, okay? And yeah, also if let's say it involves rotavirus vaccine, things like rotavirus vaccine, you cannot really postpone that because you need to complete the whole course within a certain time. It depends on the brand, okay? Some rotavirus vaccine, some brand have to complete within 6 months old, another brand have to complete within 8 months old. So if beyond that, if it has reaches beyond that stage, then the doctor cannot give the vaccine anymore, okay? So then your child will not complete the whole course of the vaccine, yeah? So yes, I hope that answers your question, Cheryl, yeah? Okay, let's talk about another optional vaccine. Okay, let's talk about influenza vaccine. Okay, so influenza vaccine will, as I said, will cover 4 different types, and that is required every year. So I will actually strongly urge you to take this influenza vaccine, as CDC has also recommended us to take this influenza vaccine for those above 6 years old. 6 months old. Okay, as young as 6 months old can take the influenza vaccine, and as I mentioned earlier, the ones less than 9 years old, they will need to take 2 doses initially, then after that will be every year. And for those above 9 years old, then you can take the vaccine, just 1 dose initially, then after that it will be every year. Okay, so influenza vaccine is also advisable not only for kids but also for elderly, more than 65 years old, the pregnant ladies, and the ones with any underlying medical condition. Okay. Okay, let's see whether there's any other question that's given pre-hand. All right. Okay, I am worried about the side effects of vaccine. So is it really safe? Okay, so in order to develop a vaccine or manufacture a vaccine, it has to go through a very long process. Okay, the first is to have the genetic sequence of the vaccine. Okay, then after that, the vaccine has to go through multiple trials. There's phase 1, phase 2, phase 3. Yeah, some vaccine will perhaps do some animal studies first, and then they will do on a small group of adults, and then after that they will do on a slightly larger group of adults, maybe hundreds of them, then after that thousands of them. Then they will see the side effects within a number of years. Okay, so then from there they need to get approval from the FDA. So these will take years and years, and after let's say if the vaccine is out and given to the public, okay, then they will also get feedback from the doctors and also the patients if let's say there's a very bad serious adverse event, and then it will need to be reported to the manufacturer. Okay, so if let's say when we talk about vaccines for children, then it will even take a longer time because they need to make sure that it is safe in adults first, and then if it's safe in adults, then only they can test it on children. Okay, so when we talk about vaccines, children really need to go through this vigorous process to make sure that is really safe for the child. But when we talk about side effects of the vaccines, most of the time it's just mild side effects, okay? So mild side effects can happen, for example, like fever, or maybe like swelling or redness over the arm of the thigh, yeah? And some may have, they feel like tired or irritable than usual, okay? So these are just mild side effects. So definitely the benefit of the vaccine is even more compared to the risk of the vaccine itself, okay? So we will also usually give paracetamol or fever medicine for a child if, let's say, they have fever 37.5, 38 and above, and give the fever medicine. So these mild side effects can be treated, okay, and can be treated, or some even resolve spontaneously. But there are also serious side effects that people are worried, but that is extremely rare. In fact, that is only what, 1 in a million, yeah. So it's extremely rare. So do think of the benefits of the vaccines first, rather than the side effects or the harmful effects of the vaccine, yeah, which is very, very minor and mild compared to the benefit of the vaccine, yeah. All right. Okay. Again, any viewers, if let's say you have any questions or you have any comments, you have any concerns, anything you want to share, please do over the comment section down below, yeah, and I will try to address those concerns that you may have, yeah. Right. So moving on. Okay. Let's talk about the next question, okay? The next question that we have. Since there's no live questions at the moment, we'll go to the questions that have been submitted earlier, right? Okay, so what is the difference between taking individual vaccines and combination vaccines? Okay, we have a lot of combination vaccines available, okay? Combination vaccines means the one single vaccine will cover against many diseases, okay? For example, something which is not available in the government, which is the 6-in-1 vaccine. Like in the government, it's only available 5-in-1, the DPT, HIV, and the polio vaccine. And like in the private, we do have 5+ hepatitis B, so that is in one jab, okay? We also have combination vaccines like MMR and the varicella vaccines, both combined into one, so that becomes one vaccine, okay? So actually combination vaccines are better because that will reduce the number of clinic visits that you have, okay, and it will also reduce the pain and swelling over the injection area compared to giving 2 vaccines one time, yeah? For example, if let's say you take the MMR vaccine and the varicella zoster vaccine, chickenpox vaccine, over different limb, yeah, compared to just one limb, why don't you just give over one limb or one leg, yeah? So actually combinations would be better. It doesn't mean that if give the combination vaccines, the effectiveness is lesser compared to giving individual vaccines, no. So if there's combination vaccines available, yeah, please go ahead with the combination vaccines, right? And I know during the MCO period, people do tend to take multiple vaccines during each visit because they don't want to come to the clinic many times, yeah. So that's okay as well. If let's say usually you take one single vaccine, your child takes one single vaccine every time, like take the 5-in-1 vaccine one time, the pneumococcal vaccine one time, but you just want to take them both together. In fact, you can even combine the 5-in-1 vaccine, pneumococcal vaccine, and the rotavirus vaccine all together. So that's fine as well, right? So but there's also a risk of getting fever, okay? Let's say if you give too many vaccines, the risk of getting fever will probably be higher, right? And also if your child might be a little bit irritable more than usual, if let's say if there's like pain over the right leg and pain over the left leg, so even if let's say you want to carry your child, you have to be careful because of the position on the legs there. So you have to be careful. So these are just some of the minor side effects that your child may have. So it's entirely up to you. Normally I will just discuss with the parent what are the pros and cons, and then from there you get to decide. That's fine, okay? So it's okay to give many vaccines at time, but some even thinks that we give same time, but it's not same time. It's the same clinic visit, but it's different area, okay? It can either, if older child, it will be different arm. If it's a younger child, then it will be different thigh or different leg, okay? So that's okay, as long as it's a different area. All right, so any other questions? Okay, let's say when we talk about rotavirus vaccine, right? Rotavirus vaccine, I hope you do know that it is a form of syrup, oral form. Okay, it's not a form of injection, because vaccines can be either injection, it can be oral form, and it can even be inhaled. But the inhaled one we don't have it in Malaysia, only in the States. Okay, so rotavirus is one of those oral vaccine. Okay. So like things like Rotavirus Vaccine, I will also highly recommend it on top of the Pneumococcal Vaccine, because rotavirus actually will prevent against rotavirus infection. So rotavirus cause severe diarrhea, vomiting, tummy pain in older children, and also dehydration. So there is a risk of being hospitalized and needing IV drips if your child has got a rotavirus infection. And if let's say they take the whole 3 courses, you will actually avoid against severe diarrhea in 9 out of 10 cases. Yeah, it's very simple. It's just giving an oral form only. Then after, it's actually very safe. Some might have mild diarrhea after the vaccine. Okay, so the age group I mentioned earlier, so you can even your child can even get the vaccine as early as 6 weeks old. Yeah, and then the number of doses depending on the brand. Some will need 2 doses and some will need 3 doses. So it depends where you take the vaccine. Okay. So there are also other optional vaccines. I think I've mentioned about Pneumococcal Vaccine. I've mentioned about Influenza Vaccine. I've mentioned about the Rotavirus Vaccine. Okay. There are also other optional vaccines available. For example, like the Chickenpox Vaccine. Okay. So the Chickenpox Vaccine can be taken as early as 12 months. Okay. And by right, the child will need 2 doses of the chickenpox vaccine at least 3 months apart. Some will give after 3 months, some will actually give at the age of between 4 to 6 years. So that depends on your doctor. Okay, so some might think that, well, it's just chickenpox, it's not important, right? But the thing is, chickenpox, even though you feel like it's just a skin infection, but chickenpox in infants, they can actually have complications from it. Some can even have bacterial infection over the skin. So meaning the child may need antibiotics on top of that. Then some will even have infection over the brain, that's called encephalitis. Okay, the viral can spread to the brain, and also they feel very tired and irritable. Okay, so in this group of children, they will be admitted. So why I would still suggest to take the chickenpox vaccine is, number one, sometimes you have to think that the vaccine itself is not just preventing your child from getting the disease, but also you're also preventing your child, let's say your child do get the infection, you're preventing your child from spreading the infection onto others. For example, if let's say you are living in the same house as an elderly, like maybe your mother-in-law, the child's grandparent, or maybe another baby in the house. So this group of people, they have their immune system is not that strong, so they are more prone to get the infection and even complication from the infection. Okay, so if you vaccinate your child against chickenpox, so you are also preventing others, other people living in the same house, having contact with the child, to get the infection as well. Yeah, so you are also protecting the younger babies and also the elderly from getting the infection. Okay, and also some are very concerned about the scars. Okay, the scars that can happen on the face or the body, especially for girls, so they want to take the chickenpox vaccine as well. Okay, so I would still recommend it. All right. Okay. Hema is asking, 2-year-old child still unable to talk and listen command. Is this normal? Okay. This is a question regarding development of the child. Okay. 2-year-old child still unable to talk and listen to command. Okay. Okay, for a child, a normally developing child, we would expect a child to start talking, at least we give the maximum time up to 18 months. Okay, by 9 months, they should be able to babble, which means they say mama, baba, mama, baba, baba, that's babbling. Then after 1 year, they will start to have meaningful words, like words that you can understand, like maybe nak, want, or cat, bird, yeah, or susu. Okay, so simple words that you can understand and has got meaning. Okay, so by the age of 2 years old, we would expect the child to at least speak in 2-word sentences. Okay, like want this, or I want that. Okay, and also they should be able to understand simple to step commands, like when they take you ask them to take something, they can actually place it somewhere else, like take this pen and put it on the table. Okay, so they should be able to do simple commands. So if let's say a 2-year-old child is still unable to talk, we need to know more about what do you mean by talking. If let's say cannot talk any single words at all, so that is actually not normal, and unable to understand command, that is also not normal. And you talk about listening command, so we are also concerned, I was concerned whether your child has got any hearing problems, right? So as a routine, usually if a child is unable to talk or having speech delay, we will also refer the child for hearing assessment to get the hearing assessed by an audiologist. Okay, and then from there we will also refer to speech therapy. On top of that, the child will need an assessment by a doctor. Yeah, don't go straight to therapy. Please bring your child to see a doctor, a pediatrician, and from there we will explore, okay, your child's development as a whole. Maybe your child is also delayed in other aspects of the development, because now you're talking about the speech. It's mainly the speech, right? But we need to check other forms of development, like the gross motor, the fine motor, and even the social behavior. Yeah, so we need to explore what the possible causes. We need to see, is your child premature or not? Maybe you have any medical problems even when you're pregnant, and then after delivery, how is your child? Maybe your child was admitted before, has history of high jaundice, was admitted before for any brain infection. So any brain infection can also cause risk of developmental delay and also speech delay. Yeah, and if let's say a child has been admitted to ICU, so that will also have risk of developmental delay there. So it's there's a lot of causes there, so we need to assess. Yeah, and in fact other behavioral issues we need to explore as well. For example, like kids with autism, yeah, they also have other developmental aspects that we need to explore, like the social, not just communication, but the social and the behavioral aspects will also be affected. So we need to look your child as a whole and get to a diagnosis and do some relevant investigations if it's necessary, and then from there we will refer accordingly to the other disciplines. Okay, Emma? Okay, next question by Miss Shu Hui. After taking chickenpox vaccination, is it still advisable to stay away from people who is having chickenpox or who has just recovered from it? Alright. Okay, for chickenpox vaccination, actually we recommend this chickenpox vaccine to be taken in, yes, infants, children, not infants, for children, and also some health professionals who have never gotten chickenpox before. Yes, we do advise them to take the chickenpox vaccine as well, because we have a risk of exposure to patients who have chickenpox infection. Okay, so as you know, chickenpox vaccine, you will need 2 doses. Okay, so it depends, again, it depends on the brand, how much is the protection. Okay, like there's actually 2 brands in the market, but after the let's say after the second dose is given, you will get at least 98% protection from it. Okay, so it's not 100%. Okay, so there is still a risk for you to get chickenpox after you're vaccinated from varicella zoster vaccine or the chickenpox vaccine. Okay, but for those who have been vaccinated, even if let's say you do get chickenpox, it will be milder. Okay, so it's not until affect the whole body. Maybe it's just a few dots, so you don't really have to worry about the scars. So to answer your question, if let's say you have been vaccinated, 1 dose or 2 doses, 2 doses would be the best. You will, if possible, please stay away from those who have chickenpox. You don't try to like be close to them, yeah, because chickenpox can be spread by direct contact which means, let's say, if you have actually touched, you touch the area, especially the ones with the fluid, so you can actually get the chickenpox from there, and also from droplets. If let's say a person cough or sneeze, from the droplets and the mucous saliva also can get the chickenpox from there. So if you ask me, even if you're vaccinated, yeah, please stay away from people who have chickenpox, yeah, because you are not 100% protected. You're only more than 90%, depending on how many vaccines you have taken. Not 100%. We try to avoid that, yeah. But so yeah, please stay away. If you are near to a person, if you're staying in the same house, must make sure that you quarantine in a different house. Wear face mask, okay, and frequent hand washing. All right, Shuhui, I hope that answers your question, yeah. Okay, so are there any other questions? If you have any questions, please post at the comment section below. All right, if any questions or you just want to share something, you have any concerns, especially during the MCO, please post at the comment section below, and I will go through from there. All right. Okay, any other optional vaccines available? Okay, I think we've mentioned 4 of them. Why don't we talk about the meningococcal vaccine? Okay, so meningococcal vaccine is also another type of optional vaccine. Okay, so meningococcal vaccine can be taken as early as 9 months old. Okay, again depending on the brand. So there's one brand that you can take as early as 9 months old, another brand that can take as early as 1 year old. Okay, so this meningococcal vaccine will prevent against getting meningitis. Again, it's meningitis means it's infection of the lining of the brain and also the spinal cord, and also avoid from getting infection of the blood or bloodstream infection. So it will prevent from getting Neisseria meningitis infection. That's the name of the bacteria. Okay. Meningococcal vaccine is known to be a travel vaccine. People are more well known. They know meningococcal vaccine for that, as a travel vaccine, especially for those who are going for Umrah or Hajj. Okay, so this vaccine is actually compulsory for them as part of the visa process. But the thing is, it is also advised to be taken in children. Perhaps you may not really hear about meningitis, but yes, it is around. Okay, it might not be as common as influenza and pneumonia, but if the infection is actually very severe, okay, there is a risk of ICU admission. Okay, and children who do get meningitis, they present with high fever, they can have fits, yeah, they can have neck stiffness, they're scared of the lights, that's called photophobia, and if they do get admitted, they will need long-term antibiotics. If it's really bad, they will need to be admitted to ICU. And meningitis also have got its long-term damage, which is again hearing loss and also developmental delay. So let's say after a child has recovered from meningitis, they will need to be followed up with their pediatrician to see whether there's any developmental delay there. So if you ask me, this is also recommended, yeah, for your child to take. So the number of doses depends on the age of the child and the brand that we're using right now. Okay, so most of the time they think that, well, it's just for traveling vaccine. If I'm not traveling anywhere, I don't need to take the meningococcal vaccine. But the thing is, it's even if this meningitis also is available in Malaysia, it's not just in overseas. Okay, so that's why it is still important. All right, so there's another question from Khairuddin. Yeah, is it true if we got chickenpox before, we already immune to chickenpox, mean won't get it for the second time? Okay, when we talk about chickenpox, you need to be very sure, is it really chickenpox? Okay, some they even confuse measles with chickenpox. Everything is campak. Campak, even measles, they say they got measles before, when actually it's just a normal rise from any other virus. So like measles is campak, chickenpox is cacar air. Okay, so first of all, you need to be sure whether the infection that you have is really chickenpox. Okay, is the chickenpox been diagnosed by a doctor, or is it self-diagnosed? Okay, and you got the chickenpox from somewhere else, from somebody else. Okay, because chickenpox usually is very contagious. You will know you get it from where. Okay, so if let's say you have gotten the chickenpox before and it's confirmed by a doctor, okay, yes, you will be immune from the chickenpox, okay, so that's called natural immunity, whereas for vaccine that's called acquired immunity. So you will have natural antibodies being formed against chickenpox, and after that you shouldn't get chickenpox anymore. But the thing is, if you don't get chickenpox, you do have a risk of getting shingles or kayak, okay. So shingles does look a bit like chickenpox because the person will have blisters, okay. So in shingles they have like multiple blisters over a very confined area. It depends on something called the dermatomes, okay, over your body, right? So it's usually confined to a certain area, and that is usually very painful. And how is shingles related to chickenpox? Is because it is due to the same virus, okay. Chickenpox is due to a virus that's called the varicella zoster virus, and when you have chickenpox, that virus is like dormant. Dormant means it's just staying still in the body, okay. And when if let's say you're under stress, or in fact in elderly, yeah, the virus will come out, and it will come out as shingles, okay. So to answer your question, yes, if it's really chickenpox, you will have natural immunity towards it, but later you might have shingles because you've had the history of chickenpox before. And if let's say you do have shingles, and you shouldn't have any contact with people who have never gotten chickenpox before, because if let's say the person has never gotten chickenpox before, that virus, if it goes to the other person, then the person will get chickenpox, okay, because it's the same virus. So yes, Khairuddin, I hope that answers your question. Yeah, so I think time's up. All right, time's up. Okay, I hope you find the messages that I have delivered beneficial. Maybe you have also learned from the questions that have been posted earlier, and also from the questions that have been posted live. So before I end, I would like to say that yes, childhood vaccinations, they are very important, okay, regardless whether it is under the optional vaccines or the compulsory vaccines, okay. Please do take, definitely you have to take the compulsory vaccines, but if you have the time and you have the financial capability to take the optional vaccines, please do. I will actually urge you to please do, alright. In fact, it's not just me, but also the CDC also advocates children less than 2 years old to take 12 different vaccines, okay, that covers 12 different diseases, and that includes the optional vaccines I mentioned earlier. Yeah, so yeah, please do consider taking all the vaccines. Even during the MCO period, I remind you again, you still need to stick to your schedule, yeah, especially for those infants, yeah, for babies less than 1 year old. But for older children, if you want to postpone a little bit, perhaps to a week or two, depending on how long is this MCO, okay, so you will need to confirm that again with your doctor and see whether that's okay. Yeah, please give your doctor a call. I think most of the doctors now will be very helpful to answer any phone calls now. Yeah, so that's all for now. I hope everybody will be safe, healthy, and take the opportunity to stay at home with your family and enjoy the time bonding with your family members at home. Alright, so take care. Bye bye.